started. So thank you everyone for coming to our sports medicine webinar, our sports podiatric medicine webinar, or podiatric sports medicine webinar. Happy to have you here with us. We have Dr. Langone and Dr. Piselli, but I will pass it off to you guys, let you introduce yourselves and move forward.
Thank you. Liz, go ahead.
Well, I have a lot less to say. Thanks to introduce then, Karen. Dr. Liz Piselli, First Vice President of the AAWP. I'm currently in private practice in Rockville Center, which is in New York. That's it as far as credentials go. Karen, off to you.
I'm Dr. Langone. I'm the current president of the American Association for Women Podiatrists. I'm a past president of the American Academy of Podiatric Sports Medicine. I'm involved in some of our political arm in podiatry as a trustee. I also write questions for a CAQ, which is like an advanced standing in podiatric sports medicine. I'm involved in a DEI committee, and I'm in private practice also in New York, in Southampton. So we're here today to talk to you about podiatric sports medicine and our practices and what we do. We are both very proud NYCPM graduates, and I also did my postgraduate training through NYCPM. And unquestionably, if you're looking at schools, you wish to be in New York. You know, people come from all over the world to seek medical care in New York. It is the best of everything. And the training that you get here from the clinical perspective will be unsurpassed. So just something to consider as you make your professional decisions. So what is podiatric sports medicine? You know, what exactly are we doing? What's different about our day-to-day than it is for any other podiatrist or a podiatrist with a different specialization within the profession? So of course, we treat athletes. That is our focus. You know, we're working with them, and we're going to see similar conditions that our colleagues who don't really see athletes see. But there are some subtle differences then in how we go forward. You will find that there are podiatrists on every professional sports team, all across the world. We are well integrated into every aspect of sports medicine at the highest levels and at the lesser levels as well. So every NFL team, every MLB team, WNBA, NBA, soccer, they've all got podiatrists who are integrated into their teams and who are a well-respected and very valued part of the treatment for the athlete. This is one of our colleagues and a friend of mine, Howard Libeskind, and he is the current podiatrist for the Lakers. He's also the current podiatrist for the men and women's national soccer teams. He also works with the Los Angeles Galaxy. And he had a player, one of the gentlemen from the men's national soccer team, who came and spoke with us and was telling us that this doctor, with what he did with his podiatry skills, enabled this athlete to have 3 to 4 more years of playing time, which, you know, for an athlete is tremendous. I mean, that's a huge amount of extra years for their career. And of course, doing something that they love. Here's a national women's soccer team, which he works with as well. We are also at the Olympics. And many of our colleagues were at the last Olympics to be held in the USA, which I believe were the Atlanta Olympics. So this is the K-tape that they use there to tape the athletes. So it's pretty cool. And then here are 2 professional athletes, 2 different Olympians that are under the care currently of podiatrists that we know and that are in our sports medicine academy. I've treated players at the US Open, which is very cool, as have many of my colleagues. So we really work our way into all these really cool professional settings. I'm going to let Dr. Piselli take it from here because this is she in action.
Yeah, back in the day. So I was an athlete. That's how I stumbled across sports medicine. And a lot of my teammates on Stanford Lacrosse, they actually had a lot of foot problems. And I noted that some of the other professionals, like for most part in colleges, the team doctors are orthopedics, and they were not great with the feet and getting the patients back, or the patients meaning my friends back as fast as I would have liked. So that was how I decided I wanted to do podiatry, and then go the sports medicine route. So from there, once I got into private practice, I was able to work with Major League Lacrosse. I did some research with Yellow Jackets lacrosse, and now some high school teams like Southside Cyclones. I was actually really lucky to be a part of the New York Lizards Major League Lacrosse team. We were their primary podiatrist. I got to help one of the stars of that team. He had a Jones fracture, which is the fifth metatarsal, was broken, and it had rebroken. And when he had come back to New York, he needed a non-surgical way to get back on the field. And I was actually able to work with New Balance and get the right shoe for him. And they were actually, which is cool. And not every athlete has this ability, but because he was sponsored by New Balance, they were able to custom make the cleat for him. As far as the Yellow Jackets go, that's that little hornet you see there. They have, it's a youth lacrosse club in the area in Long Island. And I was able to, because of my connections with them, do some research, which helped me through residency, about the incidence of injuries in women's lacrosse. And then lately, what I've been doing is working with this high school team pretty closely, where we've been dealing with some stress fractures and getting some of the better players back on the field. So there's a lot of opportunity, as Karen was saying, go to the professional level, the serious level, and then even just the high school level. But basically everyone that comes in can have an athletic injury. So that's definitely part of sports medicine.
I've been hearing that a lot recently, actually, and it surprised me that a lot of high school teams would have like team podiatrists. Is that very common now?
I think with the amount of kids that are playing sports seriously and the amount of kids that are trying to specialize and maybe even get some scholarship money, and how much pressure these kids, especially in my area, I'm sure Karen finds that as well. There's a lot of pressure from the parents to get these kids very serious very quickly, probably even more serious than I had to be, and focus a lot earlier. So the injury rate is through the roof with some of these kids, and re-injury rate. So unfortunately, yes, they've had to have team podiatrists, and I've just used my connections to be that team podiatrist around my area. Yeah, unfortunately, that is the case. I wish they didn't need us, but it is good.
Yeah.
It's good that it could be me and to get them back on faster. Whereas I find other podiatrists that maybe not be sports medicine focused aren't necessarily understanding the drive behind the player and getting them out there faster than, let's say, the usual length of time that kids need to rest or patients need to rest. There's just a little bit different of a timeline. There's a different expectation. Also, it's a lot of the player's identity is usually tied into their ability to play and their ability to perform. So unfortunately, even just for their mental health, you need to get them back doing something faster than would be like in the textbook, let's say.
When you were still playing lacrosse, did you ever see a podiatrist, or did you ever have any injuries?
Yeah, the first time I saw a podiatrist, to be honest, was for a plantar sport. But a podiatrist got my brother back playing. He had severe heel pain. My mom brought him to a bunch of different orthopedics, and then she said, "That's it. I'm going to one orthopedic said they were going to drill into his foot. I know Karen knows this story well, to remove extra cartilage. It just wasn't the case. And then a podiatrist was like, no, this is called Sever's apophysitis, which is just a growth plate irritation. And this is what he needs, and got him into a custom device. And my brother was able to continue playing. And because we were there so often, and I had gotten orthotics for, I think my first injury was actually plantar fasciitis. He was just finally like, why don't you just shadow me? You're here enough. And that's really how I got interested in podiatry specifically. So yeah, I had to go to the podiatrist a lot growing up. I have flat feet.
I do too, actually.
So this was my, actually I had a cool animation here, but so when I was at NYCPM and Karen was talking about how we're so proud to be NYCPM alum, this is what I thought was really great about NYCPM and what they had to offer was this sports medicine course. And they actually made you, otherwise you would fail the course, would go and volunteer at a medical, at a sporting event in the medical tent. And I think for me, sometimes I'm a little, shy that I don't think I would have made that leap if it weren't a requirement. So I was really happy that I did. And one of them was actually the breast cancer race for the cure we did in residency, just because I remember having fun in the sports medicine course. So the Divas half marathon, which was a blast. If anyone is interested in running at all or is able to do it, I would participate in this. It was just fun. There was all music and there's a 5K and a half marathon and they give everybody these gorgeous like giveaway bags. And then we also did the polar plunge, which was hilarious because everyone was just dressed in costumes and didn't realize how big of a deal it was. And then the Hamptons marathon and half was really fun, taken a little bit more seriously than the other two as far as the medical tent. But that was a really great opportunity that I got when I was at NYCPM. And I don't think that the other schools have that. So that's where I just wanted to do a little plug for NYCPM because that was a great course. And really,
yeah, I have no idea if other schools do it. I will say that our students, they volunteer a lot at athletic sporting events, a lot of running, like the triathlon, the New York City Triathlon, New York City Marathon, the Boston Marathon, the out to Boston, the New York City Ballet as well. There's a lot of volunteering with athletes.
Yeah, I stayed in the New York area, but my friends had gone to the Boston Marathon and a few other places. So they were able to go all over. It was really, really cool.
That's cool.
Okay, so Dr. Piselli spoke about this, but basically this is really talking about how we're involved at the collegiate level, really very extensively as well. And the high school level, as she talked about also. And now youth sports. I mean, youth sports are the fastest growing segment of the sports population. And it is just amazing to me because, when I first started in practice, I wouldn't see athletic injuries in kids until they were in high school. And now I'm seeing 8-year-olds coming in with athletic injuries. I see 5-year-olds who play a particular sport year round, 6 or 7 days a week. So everything has just gotten so intense. And these kids are just so overworked and overusing the same parts. We were having a discussion about this last week, and the rule of thumb basically is that a child should play as many hours of one sport per week as they play in free play. And no kids free play anymore. So you're starting to see these injury rates really morph down to just a younger and younger population. The one thing for us is that when you work with children at this age, you can really make a big influence for the rest of their lives, really guide them in the right way that they should train, in the right activities that they should do, and trying to focus on multi-sports in nutrition. So there's a lot of benefits. And I think as sports medicine podiatrists, that's one of the things that we do, is we spend a lot more time in education with our patients to try to get them on track and to keep them as healthy as possible.
I know that a lot of children, like their lower extremity isn't developed until a little bit later. So does that play a role in treating their injuries, knowing that they are still growing? Does that ever make it more complicated?
Yes, all the time. Basically all the time. It's a different way of dealing with them than you would deal with, the college athlete or the professional athlete or the older athlete, and that's another segment of the population that we see now, is that you have, baby boomers who were the first marathoners in the 70s and now are continuing their activity level. So I've got patients in their 80s that still run, and people are doing some pretty intense things. So it's pretty cool.
That's very cool.
These then are just serious recreational athletes. So that, I think, for most of us is a large component also of what we see in the office now. People who just really train intensely and work very, very hard all the time. These are some of my own patients doing their things. And I've had numerous patients, compete at Lake Placid. I've had patients who've done Kona, the Ironman there. So people are really serious about their activities. They're training 2 or 3 times a day and really working very hard. And for most of them, we really do keep them on track and help them to prevent just, injury after injury and keep them doing the things they love for longer periods of time. These are some running clubs that I'm involved with, and that's a great way when you want to get started in sports medicine, just volunteering your time, finding your local organizations, becoming part of them. If you can, working out with them, and if you're not capable of working out with them, then just supporting what they're doing.
I've actually heard that a lot from other sports medicine podiatrists, is that you really do work a lot with runners. Do you feel like that is a large portion of the population that you treat for runners?
I would say it's a large portion, mainly of, say, people 30 and over. And then it's more multi-sport as you get into younger athletes.
Okay, heard.
Dr. Piselli, look at yourself in this photograph if you can find yourself, but this is the Hamptons Marathon and Half Marathon, and these are former NYCPM students that we worked with there. So we're going to talk about integration and how we work with our athletes now. I don't want to scare you with any calculus there.
Well, I was scared.
Yeah, I was kind of scared too when I made the slide.
I was nervous when I saw that slide.
Okay, so we're back to what are we doing? What's different about us than others in our profession? And really, it's a mindset. It's our mindset as doctors. Dr. Piselli talked about this already, working differently. Recognizing that these patients want to get better faster and they want to become stronger, and that has to be part of your treatment plan. And it's also their mindset. When you work with athletes, you have to be prepared to spend a lot more time with them. People are going to come in with a bag of shoes, all the different running shoes they've had, all the different devices that they've tried, different braces, different orthotics, all kinds of gear that they've gotten to try to enhance their athletic activity. So it's their mindset that they want to be better much more rapidly than any other person. And also that we need to be aware of that all the time and working towards that goal. It's also too, our mindset has to be that we really know these sports, so that the first time I ever saw an Irish step dancer, I had to hip the books because I had no idea what they did, how they did it, or the shoes that they wore. So you really have to integrate yourself and really have a good knowledge of the sports that people are coming in with and what their routine is. We have an athletic questionnaire that we use because we go over with patients, what is your training program? What are you doing? Define it for us every day of the week. Are you on any special diet? Do you take any different supplements? And you have to be prepared to really work through a lot of this stuff with your athletes because they want to run and be happy. So we look at the foot and the ankle primarily when patients come into our office. But one of the things that we do as sports medicine podiatrists is we just don't hone in on that area. We're looking to see how that foot and ankle movement is affecting them, the entire superstructure, and how it's carrying their entire body. So the things that are going on within the foot are going to have ramifications in the lower leg, in the knee, in the hip, in the back, all the way up through the skull. So when we look at our athletes, we look at them from the base to the top. So it's a different perspective also. The patients that we see too basically come into us because they're doing too much. Their issues are related to overload. Other patients, a lot of their injuries and a lot of the things that we see are due to the fact that they don't do enough. So we've got the opposite end of the spectrum there, where we're looking at our patients and it's because of the extra stress and forces that they put into their feet, magnifying little imperfections in their movement that are causing them problems. So again, what we want to do when we look at patients is we watch them walk. We're going to watch them in their sport too. So I like to take patients outside and watch them run. Anybody who's in a running sport, I'll watch running. But also too, now with video, it's really easy for parents to be able to get videos of their kids in sport, so that we would be able to see Dr. Piselli on the field and be able to tell, what, if anything, was wrong. But she was perfect, so nothing was wrong. But this is kind of the way our patients think, and this cartoon says, look, I know it's ruptured, doctor, but surely I'll still be able to run in the marathon tomorrow. And that's the attitude of our athletes.
That's really impressive that you have such a trained eye that you're able to like watch someone run past you very quickly and be like, oh, I see that issue right there.
It starts to get to be one of those things. Like I always get in trouble at traffic lights if pedestrians are crossing, because I start watching everybody walk, so then people are honking at me because I'm busy watching. And, I say to my kids like, oh, should I give that person my card? And
I was
even
like
now,
throwing your card out of the window. Yeah.
But even now my kids will say to me, hey, that person really, they pronate badly, or their walk is not good. So, they've heard it so many times that now, it's ingrained in everybody.
That's crazy. That's cool.
And if I can add, like, you can get better. Like Karen can watch someone one pass across, and me, I'm like, you just walk one more time, just one more time.
Well, that makes a lot of sense to me. Like you would need a lot of time and a lot of observation to really train your eye to see it so quickly. As I was thinking, especially if someone's running, like it's not, if they're running in front of you, it's not like you have a video of them going in slow motion. That's just wild to me.
Well, what's good now, though, with iPhones, it's so easy to do that. You just put your slow motion video on and you can really break it down. And it's really impressive, too, because no one ever gets to watch themselves walk or run. So then when you can show them all the things that are not really good, they're amazed. It's funny because 2 weekends ago, I was at the American Academy of Podiatric Sports Medicine standalone meeting. And we work a lot with Brooks, the shoe company. And one of the things that they did was they were giving gait analysis to all of us. And I was so excited that I would actually have a gait analysis, because when I hold the phone above me and behind me, it doesn't really work out very well.
Yeah.
But this was really exciting to be able to see what's going on.
That's so cool.
What did you find out?
Yeah. I'm not going to, I don't want to discuss it here. It's personal,
Heard.
Anyway, this is showing you one of the things that we do in sports medicine, which is when we have an athlete who is injured, we work to find ways that they can continue to maintain their fitness while they work through their injury. So here you have someone, in a cast boot, not really able to ambulate or walk, but we're going to allow this person to do some upper body work and some other things so that they maintain some of their aerobic fitness, some of their strength, and probably most of all their mental sanity while they go through the healing process. This is an Alter G. So an Alter G is a treadmill where the patient sits, I don't know if you can see it, in like that bubble belt around their waist, which offloads them so that they can actually start, when they first work with the Alter G, to be completely off weight bearing, and they're just kind of tapping down really lightly. And then as they improve and get stronger and their injury progresses, you can add more and more weight bearing onto them. So it's a good rehab.
So it's like an anti-gravity treadmill.
Yeah.
Interesting. I actually think I had to do this, or was supposed to do this for physical therapy. I was like, that's weird. No thanks.
With sports medicine, and I'm sure, Liz, you can jump in on this one, you've got to know your shoes. Shoes are a huge thing of what we do, because basically every patient that you ever see is going to say, what's the best shoe? And there really isn't a best shoe. There are many, many good shoes. And then there's probably several good shoes for any one particular patient. And it's really knowing how they move, what their foot movement is, what their injury is, what they're training for, what their goals are, that help you to determine. But shoes change constantly, and keeping up with shoe technology and the new things in shoes is kind of a part-time job. Liz, what's your thoughts on that?
I would agree. I think it's funny. Well, especially runners, they'll come in and they'll have an intense knowledge of shoes, and so you have to be able to keep up with them and be able to talk the talk. But also I love when a patient comes in aggressively, like, well, listen, I tried Hoka's and they were terrible for me. And then I tried these and the Nikes and they were bad for me. I'm like, whoa, just because this is good for, Jane Smith down the road doesn't mean that that's the right shoe for you. But they love, sometimes I feel like it's a bit of a test too, with athletes, trying to say like, hey, I have tried a bunch of these shoes that were supposedly great for me, or the On Clouds. That's one that makes me nuts. But these are supposed to be great. They cost me so much money and they're so comfortable, but I'm still in pain. And I'm like, yeah, you're still in pain, and yet you're calling this a comfortable shoe. So you do have to kind of re-educate people, and don't be surprised about that.
Do people come into your offices specifically to find the right pair of shoe, or is that just like an add-on to an additional issue that they're having?
It's usually part of the issue. I feel like a lot of these overuse injuries, you can actually do a little bit of history. I mean, you should be doing history taking anyway, but they'll have said, I tried this new shoe, and they don't even make the mental connection from point A to point B. Once I tried this shoe, it awoke something. Like they might have always had this biomechanical imbalance, but once they tried this shoe, that's when it all erupted. Or when they started commuting into the city and the terrain for them, or like Manhattan's a lot of concrete. So when the terrain changed for them, they might have been wearing the same shoes. So it's both getting that history. And yeah, I do find that some people come in for shoes, but it usually just comes up organically in the conversation is the shoes. Not usually, it always does.
And how do you go about finding what is the right shoe for them? Like, what is that process?
Well, Karen will be able to expand upon this even better, but really you just have to do a biomechanical exam. So you're doing exam, checking the range of motion. For some of the patients, like the older patients, I also check for fat pad atrophy. So the fat pad that cushions the bottom of their feet might be gone, and they're going to need a shoe with just a little bit more cushion. And then my patients with a little bit of neuropathy, in other words, they have some nerve damage, either from back or anything else, really, I'll actually put them in a stiffer shoe for a little bit more biofeedback. Whereas other people that don't have those limitations don't need that same sort of increased shoe prescription, for lack of a better term. And Karen, I'm sure you have much more to say on that.
No, I think you covered it really well. I mean, it's really a question of what we call their biomechanics, their range of motion, and then how that translates into their movement. That helps us to determine what's going to work for them. So opportunity in sports medicine is tremendous. Opportunity in podiatry is tremendous. The population is becoming more and more active in every age segment, and the opportunities to be successful and to have the type of practice that you want are there. It's just a question of, really focusing on what you want to do, having a good way to do it, being well versed, but it really is tremendous. And again, we have podiatrists at every level, from professional down to people working with youth sports. There's a lot more of us working with college, high school, serious athletes, and youth sport athletes versus those working with professional teams, but we really are everywhere. So it is a great aspect to get into if you enjoy sports. Our professional branch is the American Academy of Podiatric Sports Medicine. Here you find a lot of like-minded people, a lot of great research, a lot of great education, wonderful colleagues, a lot of good knowledge goes on here. So this is a great group. If you go to podiatry school, or when you go to podiatry school, join your sports club at your school. And as Dr. Piselli said, you'll be covering all sorts of athletic events, and it really is great.
Yeah, and the American Academy of Podiatric Sports Medicine, is that something that you join after you've completed residency? Or when would you be able to join the? You
can join as a student. There are student chapters at every school, and then you can continue while you're a resident, and then as you get into practice as well.
Okay, and that also helps, I guess, with networking too. Like, you can get to know the right people who then can introduce you to the right people, because I've heard that that's a big part of podiatric sports medicine, is just getting your name out there and getting to know a lot of people who know the industry really well. Do you feel like that was a similar experience for you?
My time in the academy when I was an officer and then president was unquestionably the best professional experiences of my life. We traveled all over, even out of the country, lectured extensively. I met colleagues from all around the world, people with all different viewpoints, and it was just absolutely tremendous. We were at all the colleges, we interacted with the students a lot, we educated. My colleagues were phenomenal. And we all remain good friends, and they are some of the brightest people that I've ever had the opportunity to be around. So it's just a tremendous organization filled with great people.
That is a glowing review.
The American College of Sports Medicine is the worldwide community of sports medicine professionals. They hold a conference every year in the United States that attracts about 6,000 different sports medicine professionals, from sports psychologists to researchers to people practicing sports medicine at every level. Every single year, we lecture, and we are part of this community. And again, I have met some of the most amazing people there, lectured with wonderful colleagues, and had just a really great time and exposure to thought processes from all around the world. This is also an organization you can join as a student and continue with, but it is a great community of sports medicine and sports-minded people. These are some of my colleagues from the American Academy of Podiatric Sports Medicine, everybody doing their thing. And I think that's important too, that to be involved with sports medicine, it's good if you have a love for it. And it's even better if you are able to participate on some level in it as well. Up in the upper left-hand corner, those are my feet on the warning track at Yankee Stadium. So that was pretty cool.
So you yourself are a runner then?
I do something with my feet now. I don't know if it qualifies as a run, but they get out there and they move about.
Okay, heard.
One of the great things that we do in podiatric sports medicine is our involvement with Special Olympics. We've kind of been shut down with COVID, but we have what's called Fit Feet at Special Olympic events, especially the national level and the state level. They set up like an Olympic village of medical professionals. And one of the things that we're able to do through AAPSM, again, is to see athletes and screen athletes at this event. And it is just exceptionally fun and rewarding and just a beautiful experience. And again, as a student, you can get involved doing this as well. We take students to all these events. It's wonderful because we get to spend a lot of time with the athletes, and we really get to educate the students a tremendous amount. So it's really great. These are different publications that, again, from my involvement in sports medicine, I've had the opportunity to be featured in. It has opened up, all kinds of worlds for me. Had a lot of fun doing a lot of really fun things, even was shoe shopping with someone from Slate. So, pretty cool stuff all around. But again, great opportunities. These were things that patients from all over saw me in. It was really cool. I was also in Good Housekeeping, which if Good Housekeeping knew how I cooked, they probably would have never featured me. But, just great opportunities. Most of this was talking about just general fitness of the lower extremity and a lot of focus on running shoes and picking athletic shoes. Volunteering. We do a lot of volunteering in sports medicine. Liz was saying how, we go to all these different races. And of course, all those different races you go to as a student involve doctors who are graduates who come back to help out with all these things. So really great. I'm sure there will be NYCPM students at the marathon this upcoming weekend. There'll be tons of docs there. I worked the marathon for many years. I've done Boston. You were talking about Boston. Nothing is better than the New York City Marathon, hands down, best event around. finish line for the New York City Marathon. So generally, as podiatrists, will be stationed along the route. But then some of us get to be up in these tents at the finish line, which is an amazing experience. Just really, really great. I've done work with all these other volunteer organizations, Tour de Cure, American Diabetes Association, Team in Training, all of these different organizations that are looking to get people trained to do these events. They all appreciate someone with some knowledge coming out, sharing with their athletes, a lot of whom are doing these things for the first time, you know, how to choose shoes, how to train properly, how to stretch, lots of opportunity in doing all these different things. So my final thought is this. This is Dr. George Sheehan. He was a cardiologist in New Jersey, and he was one of the first people to really promote podiatry in the 70s. And he would say everyone is an athlete. The only difference is that some of us are in training and some of us are not. One of the things I take very seriously about what we do as podiatrists is encouraging all our patients to be as active as they possibly can be. If we could do one thing for people that would improve their health more than anything else in the world, it would be to encourage them to be physically active. You know, we would reduce diabetes, hypertension, you know, so many things if people were able to better take care of themselves. And I think in podiatry, one of the great things that we do is we give people that ability. You know, we make them stronger, we make them able to be mobile, we make them able to live their lives and to do whatever it is that they wish to do. And I think that's a phenomenal gift to give to people. And that's what makes our profession great. And it's good to walk the talk. So in addition to talking the talk, we ourselves should set an example and we should walk the talk. And as we encourage our patients, we should also encourage ourselves to be as physically active as we possibly can. And that is it for me. Dr. Piselli, you want to add anything?
Just expand upon your last point. I think it was some Bartold I heard in a podcast say, if you're unable to be active at least 30 minutes a day, you need to restructure your thinking and restructure your priorities. And I think that's so important. And I've been stealing that line and using it on a lot of my patients. So just to reiterate that point.
What is this ring from? The New York Yankees?
That's World Series ring for the New York Yankees. That's my hand.
No one baseball.
She hit a home run in the last World Series.
So I'm going to open it up to questions. There is a Q&A area, but in the meantime, I just want to ask you guys, you know, from me, what are some of the most common injuries that you are most commonly treating?
Go for it, Liz. I see you.
Lately for me, it's been stress fractures. And I'm wondering for the youth players at least, and I think this might be because of the new field turfs that are getting put in, but that's just my running theory. And I think it is important to always be analyzing why something might happen, especially if you see a pattern or a reoccurrence of it for many athletes. And lately it's been the stress fracture route for me.
Dr. Langone, what about for you?
I would say Achilles tendonitis, then plantar fasciitis and stress fractures would run 2, 3.
Okay, heard. Another question that I have is, I mean, you talked a lot about needing this knowledge of shoes, right? And obviously that takes time to accumulate, but how did you get to a point where you were so knowledgeable on shoes? Like what resources did you use? How did you learn? Just over time?
Bartold Clinical. He's really great at analyzing shoes. You have to pay for the membership, but he even does a fun thing during the Olympics of analyzing the shoe metal count per shoe company. I think that's kind of a fun thing. Otherwise, I just ask Karen.
Well, we're very lucky. We have a really good local running shoe store, and I'm able to go in there and really pick their brains about a lot. And then through the years, you know, again, with my involvement with the sports medicine community, The shoe companies, really get in touch with us a lot and try to keep us as up to date as possible on what they're doing and why they're doing it.
Okay. And then I have two questions right now from from people watching. One of them is asking what a typical day looks like for you guys. Like, at what time does it start? What time does it end? What cases do you see, and so on?
I have kind of an atypical schedule. So maybe Karen.
Can you elaborate on full schedule?
My schedule. So I'm part-time right now. My kids are little. So right now, and I'm just really establishing my own practice. I work for Karen. I do surgery probably once a month, once every 2 months, just once a week. And then I'm working 4 days a week and for variable hours, just because, just by patients and childcare, really.
Dr. Langone, what about you? What's a typical day look like for you?
Well, first I want to say, I think that one of the benefits of what we do often is what Dr. Piselli is doing with that flexibility to be able to set things a little more to your own liking. Basically, I'm in the office generally. I get there like 9:15 or so, and I usually leave maybe about 6:30 or so. And I'm in the office 4 days a week. My fifth day, I now am treating myself because I'm old and I've been doing this for a really long time. So I spend Fridays with my granddaughter. I do a lot of work at night. I do a lot of my other things, my involvements in all these other committees and all at night and on the weekends, kind of like doing this lecture and doing a lot of the other stuff that I do. But I really enjoy it.
Another question is, why did each of you choose NYCPM? And if Dr. Piselli, if you want to start.
Sure. For me, the choice is easy. There's one New York school. I'm from New York. I love New York. And my podiatrist said, he goes, you may be able to get different, there might be more bells and whistles at other schools, but the best clinic experience is NYCPM because it's the busiest clinic. And also you're getting really, as Karen alluded to before, the international experience because it's New York, you're getting people from all different countries, all different socioeconomic backgrounds, and it's just such an education from the clinic standpoint. So I think the first 2 years are pretty much the same everywhere, but that clinic is second to none just because of the busyness, and you just see some crazy interesting cases, and you get to work with some great staff in that part.
Okay, Dr. Langone, why did you choose NYCPM?
That was easy. When I did a bunch of interviews, and I think NYCPM was my third school that I interviewed at. And when we walked through the clinic, you couldn't even get through the hallway. There were just so many patients everywhere, and it was just overflowing, and people were so enthused, and patients were really grateful to be there. And that's all it took for me, was to see that, and also to the realization at the time, the neighborhood was different. Most of the patients that we saw were patients who really sought out the school as almost like a primary care area. Most of them were underserved medically. Yeah. And I really felt that if I could help those people, I could help anybody. One of the first patient that I ever did an H&P on in the hospital was a young man who had Kaposi sarcoma. And this was before anybody was really on the radar about HIV and AIDS. This was just as cases were starting to show up in New York. That's the kind of experience you have in New York. Like, if it's going to happen, it's going to happen in New York. Yeah. And again, people are coming from all over the world to New York for their medical treatment. It just doesn't get better than the exposure that you have and the knowledge that you can gain in New York.
Yeah, that's so true. I say that almost every day. I'm like, if it exists in the world, it exists somewhere in
It's
New York
here,
City.
right?
Yeah,
It's
and you
here.
will see it. Yeah,
Right. Look at
that
even
is a
now,
big one.
right. COVID,
Another question that
monkeypox,
we
all
have.
these things
Oh,
came here.
sorry, go ahead.
No, go ahead.
Okay, another question that we have is whether or not you have heard of podiatrists who are working with NASA as space, like in space podiatric medicine, or have you heard anything in that area? No?
I haven't.
Okay, I actually have a
I have
student right
not.
now who's a second year at NYCPM who that's his goal is to be like to go and graduate and then work for NASA actually. So
That's amazing.
I don't have any way to answer this, right? Because I am not a podiatric medical student, but if this person wanted to email me, I could probably put you in contact with that student because I'm sure he has a lot to say about why that is his goal. Another question we have is, did you ever consider an alternative specialty? Like, did you consider orthopedics, for example?
I did. I shadowed orthopedics. And obviously I was dealt with a lot of orthopedics with my team. Like I said, the team doctor was always an orthopedic. And what I found for women, and this is, then that was 15 years ago when I was deciding, I found it was a much harsher environment for women in orthopedics, especially in the residency and training. And it's a very much, and it was a very, I want to say this, it was very much more of a bro mentality, and it felt like it was a lot harder for women to break into. Whereas I saw a lot more women podiatrists. And so for me as a woman, that would be important that I would have some role models. And it just felt like it was a field that I could, as Karen was saying, and now I'm doing it, I'm living my dream where I'd be able to have my family and be able to practice and see all the types of patients that I wanted to see and be able to do that. And that was really my rationale for going into podiatry, and only having 3 years of residency and still being able to do foot surgery was a big draw for me. You're in less debt because it was less expensive than medical school. So those are all the reasons, practical reasons that factored in.
Dr. Langone, did you ever consider another specialty or another field of medicine?
No.
This was it for you?
Yeah, this was it.
I respect it. Obviously, I'd love to hear it. I know another big draw for people is that guaranteed surgical residency, right? Like you go into another field of medicine and you have to be top of your class to get the residency program that you were interested in, or to get that specialty that you're interested in. And it's not like that in podiatric medicine. It's a lot more of a collaborative field. Like, what you're getting into, and then you get exposure to everything, and then you can kind of pick and choose what then works for you in your own practice, which I think is a really cool difference.
It's really cool because I'm even at the point where I'm like, well, I've done surgery, and you know what, and I thought that was going to be the way I went. And really, I find that I like the clinical side much better and the non-surgical routes so much better. And I find that that's a better fit for me and my personality. And I'm kind of steering clear of surgery in for a lot of cases. And I think that is a nice freedom that I have. Whereas if I had done orthopedic surgery and then I'm like, I don't know if you can't be an orthopedic surgeon and say, I don't think I'm going to do surgery anymore. But in podiatry, there's a lot of non-surgical things you could do, especially with sports medicine. I mean, so the flexibility is really nice.
Okay, does anyone have any last questions for Dr. Langone and Dr. Piselli before I ever so briefly touch on some like admissions and NYCPM specific stuff? It's your last chance. Also, Ali, I don't know which one. I have your email, so you're good. I'll email you. Okay, we've got someone saying thank you, and that they obviously really enjoyed your time. Obviously, I also thank you. This was great. I've learned a lot. I think that this has been very helpful, at least for me, in terms of like admission specific stuff. This has been great.
Great, thank you.
Thanks.
Okay, well, I will go ahead and briefly touch on some admission stuff. Dr. Langone, Dr. Piselli, you are free to leave. Thank you so much for attending. This was great. So just to quickly go over some of the admission stuff.
Thank you.
Yeah, sorry. Okay. Our admissions requirements, our prereqs are pretty standard, right? You've got a full year of bio, full year of chem, same with organic chemistry, physics and English. We need the MCAT, 3 letters of recommendation. Our overall GPA average is about a 3.2 and a science of a 3.0. You apply through a service called ACMAS. I'm not going to read all that out. It's way too many words. ACMAS. Our application deadlines are November 30th and June 30th, and that just depends on which term you are applying for, which brings me to my next point, which we are the only podiatric medical school to have a January program, a January start, which is pretty cool. And it's a slower transition into medical school. So that takes all the classes that you would normally take in your first year, and it spreads it out amongst 3 terms instead of 2, but at the same price. So it gives you a lighter course load. And this is something that we tend to recommend for people who maybe like haven't been scoring as highly on their MCAT, or have some gaps in their transcripts, or maybe have been away from academics for a while, or even just want a lighter course load for a little bit because they're worried about that transition, because it's hard for everybody. And then you get a summer break and everything like this. But yeah, I will open up the floor for any NYCPM specific questions. If anyone wants to take this post presentation survey, that would be great as well. Just like 2 or 3 questions, I believe. And otherwise, you guys are free to go. Thank you so much for attending. This has been great. Yeah.